Wonderful to have you with us and starting the program. And only one thing, I borrowed 5 more minutes from Subnis to complete my.
Vikas Agarwal is another. We are very, very happy that Vikas Agarwal is joined. He has done huge number of transplant. He's settled in Delhi, and at so many centers he has started doing transplant. In fact, of late he has done so many complicated transplants. Number of multiple vessels, pediatric, high BMI, foreign national, so many things to his credit. So Vikas, we are extremely happy when we read that you have done so many complicated transplant. We feel really very happy and feel very, very proud about you. So please share your experiences, how you started your journey and what have you come so far.
Thank you very much, sir. And it is my great privilege to be among the stalwarts and my MPUH alumni. I think I'm audible and my slides are visible, sir?
Yes, please go ahead.
So in MPUH, I was in resident from 2010 to 2013. Whenever I see this slide, and I feel very proud to see that I am in one of the MPUH alumni, down the line down, so many seniors and teachers are above me to guide. So it's very good privilege for me. And my teachers and mentor, Dr. Mahedesai sir, everybody knows he's a great visionary, and Sabni sir always helpful and always helping us, teaching everything. Muthu sir give us the small tip about the fistula formation and the vascular anastomosis. Dr. Ganpule, I always remember whenever he used to do lap donor, before the transplant, he used to call before evening to the donor, do the ultrasound, see all the reports personally, and he take meticulously everything so that donor does not feel any complication. So it was a great, whenever we do, so we always remember the principle. Rajapurkar sir, we always remember initially in a frightened matter, whenever we go to the Wednesday transplant meeting at NADIAD. So it was really shocking that sir is sitting in front and we will ask so many questions. But later on, once we start doing the transplant, we always admire that sir has taught us so many small things and never neglected even a small vomiting, small episode of fever, and small drop of the hemoglobin. It is very important whenever you're doing the transplant, you look each and every aspect. And Shishir Garsang and Hegde sir was always helpful. And I will also like to gratitude to all sister staff at NADIAD, and especially Deepthi sister, and who was always helping us when we were the resident and all our patients. So my journey starts when I joined back in Delhi at Max Shalimar Bagh. I asked sir to give the certificate so that I can apply for transplant. So sir gave me this certificate by 371 kidney transplant performed during my residency. And then this was the motivation to start. And now I have done almost 388 independent kidney transplant after leaving the NADIAD. So initially I joined the Max Hospital. Dr. Atul Goswami used to come to NADIAD and he called me, let us make a team and do the transplant. So I did start the Max Hospital Shalimar Bagh. And that initial time we start for the transplant program permission. It requires a lot of efforts when you start in a corporate hospital or in a initial start. So everything you have to do, the transplant coordinator, transplant setup, dialysis, everything. So I was lucky to start that program. And but meantime, we were getting the transplant permission. We will get proficiency in getting the laparoscopy urology, because that was my main concern initially when I started. So doing all laparoscopy, partial nephrectomy, radical cystectomy, and everything radical prostatectomy, which we learned at the NADIAD. So I could do that time. So in the 2015, we got the permission, and I was lucky to have Dr. Wahid Jaman. He came from Apollo Dhaka, and he was my senior, my colleague, who taught me each and everything about not only about the surgical skill, but also the mannerism you have to develop the transplant program, the team efforts, everything. He has given me that opportunity. And initially in the first year, we did the 28 cases, including all initial challenges, including the ABO incompatible and deceased donor, which was very difficult in happening into the north part of the India. And we, from the very first, we start the lab donor. And I would like to mention Dr. Ganpule, for some reason, visited a few days before when we planning for first lab donor nephrectomy at our institute, and he gave me the confidence, because you start initially the first case with a lab and you will do it. So I thank to Dr. Ganpule sir, and he gave me the courage, and from that time I have never done any open surgery for the lab donor, and we are touchwood successful in doing all kind of double vessels and the right side in the first year. So in the first year, when I got this much confidence, I went to the WC 2016, because from the NADIAD, we have always been keen that we present whatever we are doing so that we can learn many things. So WC 2016, I've been lucky, and all Vikas and Mahid Desai sir and everybody was there to admire that point of technique which I dissected in the hilum dissection and present in the WC Cape Town. So then because initial time we could do the cadaver transplant, so we did so many activity among the school, the colleges about the organ donation, and that resulted that we were recognized for deceased donor program in second year. We did 8 kidney transplant in a year with the deceased donor, and this was the youngest 17-year-old boy whose father came forward and donated all the organs and from heart to and everything kidney. And I would like to mention the last kidney transplant of cadaveric, which I did at Max, was of my own batchmate, which is in the next photograph. And she was my MBBS batchmate. Initially, she went first transplant live related, but now she was again on the dialysis dependent after 20 years. So I could do the deceased donor transplant of my own batchmate. And so that was another, I feel, good thing about the transplant. But slowly our management issues started, nephrologists become resistant and the program started declining. So that time in 2017, we talked with Dr. Vikas and we made a team of group of 3 or 4 urologists, and we took out the 3 hospital in Delhi NCR by the VPS Rockland name. But unfortunately, Dr. Vikas could not join, but finally he gave us the guidance and we did make a good team of the urologists and do the 22 cases in a year in the new hospital starting from the scratch in many senses. But we had a nightmare experience with grapholone injection, which was immunosuppression that time given. But finally, again, this management, the VPS group, which was attached from Dubai, has started declining, and our teams of the nephrology initially moved. So I got a chance that I could help my colleague also. Rajiv Sarpal was in Himalaya, and Shahbaz, my nephrologist, during my time in the NADIAD was together, and they called me for help in the Himalayan Institute. So I could mentor 12 cases in that case in that Himalayan Institute, and that was a beautiful time. And then in 2018, I joined a reputed institute like Asian Institute, where the nephrologist was from Medicity moved with me. And we did 132 cases in a 2 year, including all challenges, multiple vessels, obese recipient, retransplants, ABO incompatible, and the swab kidney transplant. This time also we thought that we will start the disease program, but we were in the process that we will continue with that. And this was the very challenges journey. And touchwood, my 2 colleagues with the urology with me and the nephrologist, the Ritesh and the BK was with me, and we could do good on number of the domestic cases. Initially, it was all the outsourced cases, but we could develop the benchmark into the Faridabad that we are the maximum number of the transplant are doing at the Asian hospital. So this time I presented my first of injury. This occurred during the right lap donor nephrectomy, which was IVC injury. And that again, I managed with laparoscopic. So I did not convert it, and I got courage to do the IVC injury repair with the laparoscopy, and for which I was awarded a prize at DUSCON, the National Conference of Delhi Urological Society. And then I presented, because many patients that time have done with double vessels previously I have done, but triple vessels and the 4 vessel. This was new when I joined at Asian. So I could present this in the CAST conference with the 2019, which happened into Delhi. So I present the different technique of doing the re-anastomosis by the triple vessel, either pajama technique or by the anastomosis to the end to side to the main artery and the separate anastomosis to the inferior pagastric artery. So I could manage the 4 renal vessel up to, and again with the laparoscopy technique, we retrieve the donor and do the transplant. So all touchwood with all the guidance, it became successful. And one complication we had, because right side donor, we used to staple the renal vein with the stapler. And that time there was fault into the stapler and we could not open the stapler. So it fired, but it could not be opened. But luckily, we managed with laparoscopic Satensky clamp and we came out. And this problem I discussed in the urology ComCon 2019 and was well appreciated. And now 2019, before the COVID started in the 2020, so my previous team of the nephrology, which was as Rockland, called me again, let us start at Akash Healthcare with new beginning, with new everything, because the Faridabad was very far from my house. I live in Gurgaon. So then I shifted to Akash Healthcare Dwarka, which is again a new hospital, and we started the transplant. And we have the good nephrology team of the 3 nephrologists. Separate is our pediatric nephrologist with us. So we have good number of the people, urology, nephrology. Right now we are doing 4 to 5 kidney transplant per month. And international OPD we used to do regularly, and we are getting many of the international patients. And we are especially focusing on the pediatric nephrology department also. So in the transplant, again, we continued in the COVID time, initially with the Hichak, and then again we have to start. This was international patient, and he post-transplant developed the COVID. And it was really a tough time. I discussed with my senior, myself, Sabni sir even also. So, but luckily with 30 days into the ICU with non-invasive ventilator, he came out. He was a young patient, and that was a victory of all our ICU team and the transplant team that we could survive in the COVID time also. This was a difficult time, but finally this patient survived and went back to his country very well. So again, the doing the transplant give the confidence that we can do some difficult kind of the cases. This was the patient who had upper ureter completely lost, and he was tried outside a reputed hospital for the bowel interposition, but due to the dense adhesion, they could not reach to the hilum. So finally, we did the laparoscopic nephrectomy in this patient. There was massive adhesion at the hilum, and we did the auto transplant into the left leg fossa. This patient was from Bihar, and he came last month only, and he is doing absolutely fine. So it gives again thanks to NADIAD who give us the courage to do this kind of the challenges cases, and we took up these cases, and this we could save the life or the kidney of this kind of the patient. So last week only we did the multi-organ retrieval, which was again after 4 years, because in Delhi there is so much negativity among the, and it's very difficult to convince the patient. So this patient again 57 year in house in our ICU, and family after consenting give the 2 kidney and the liver and the eyes. So we could transplant 1 kidney, and we transfer the another organ with another hospital. And this again at 4:30 a.m. all the team was enthusiastic and took a photograph. So this gives really heart feeling happiness whenever you do this kind of the brain dead patients transplant besides the liability transplants. And this case we have done on the Tuesday. The 7-year-old boy who was having posterior urethral valve and both kidney was damaged. So we did the transplant, and again with the grandmother, adult kidney. By seeing the Dr. Lokesh slide previously week, yes. So I was little bit scared, but finally everything goes well. Extraperitoneal, we could anastomose to the common iliac artery and the vein, and right now the patient is doing absolutely fine. And thanks for all the guidance. So now I would like to thanks and regards to all my teachers, colleagues, and of course the patients, and special thanks to MPUH AMA. And still there is long way to go. This is my just starting journey of 8-year post NADIAD. So with all the wishes from Sabni sir and everybody's, Mahisha and everybody, nephrology, urology, and my colleague, full MPS sports and all of my seniors and juniors. So we will be able to reach further heights. Thank you very much, sir.
Thank you, Vikas. It was so nice to hear from you. So much of complicated cases, so many places you have changed, so many centers you have started, so many colleagues you have taken along with you, and so many places where you have done this transplant. It was really courageous, and we really admire that. You have really made us very, very proud, and very nice to see your journey. Wish you all the best. Well, next I